Hello and welcome to an overview on the Early Start Denver Model intervention for young children with autism spectrum disorder. This is an evidence-based intervention used for children from 12 months to around 60 months. It combines developmental and behavioral strategies to foster growth in social skills, cognitive, and communication abilities. It does this through a naturalistic approach to play and other daily activities. This means that it can be used in one's daily routine and can be used everywhere, from at home, daycare, or at the clinic. And it can be used by therapists and trained parents. The Early Start Denver model is a combination between the Denver model and the pivotal response treatment intervention. The Denver model focuses on building a positive parent-child relationship while also trying to motivate the child to learn and participate in these activities. The pivotal response treatment also focuses on motivating the child to participate in their learning and these communication activities while also maintaining a more naturalistic approach to kind of let the child take the lead. Combined, these two treatments create an environment where the child can increase their social interaction and learning while also piquing the child's interest and letting them take the lead on their educational journey. This approach is meant to encourage language use, decision making, taking turns, and overall interaction with their communication partner. For example, if a child was getting dressed with a parent, the parent might encourage the child to choose between two shirts or two pairs of socks to promote that decision making and showing some sort of language use. Now we will watch a video demonstration of this intervention. The child in the video wanted to play Ring Around the Rosie, so the parent will use this as a learning opportunity and as a chance to allow the child to engage with them. As they are playing the game, the parent will sing the song, and at the end of the song, they will encourage the child to finish the song by saying, "down," and then will immediately reward the child for this interaction by falling down dramatically. So now we're going to talk a little bit about parent training and the importance of it within ESDM. So we realized that parent training was extremely important because the parent or the caregiver will be the primary provider of this therapy. Training promotes confidence for the parent or caregiver as a provider and allows a space to access support from the overseeing professional, which could include asking questions or just any concerns that may arise. They can kind of discuss it with the speech therapist or the main provider. And it increases the parent or caregiver's well-being while providing therapy to the child, which is an important part of being able to provide therapy, is having confidence and excitement for the therapy so that the child will be able to buy in as well.
All right, so in order for ESDM to be successful, consistency is crucial. Research has shown that this intervention produces significant results in higher IQ, increased spontaneous communication, and overall improved language skills. This is a result from interventions lasting from 10 months to 2 years for over 10 hours a week.
Research shows that parents of children with ASD experience higher parenting stress when compared with parents of children without ASD or with different disabilities. This is caused by factors such as parents' knowledge of the disorder and what to expect, access level to intervention, and awareness of self-care and coping strategies. Luckily, ESDM takes stress right away from parents. Implementing the model helps to educate parents on how to interact and connect with their children constructively, provide accessible strategies independent of any factors restricting access, and inspire confidence within their parents alongside teaching them how to cope with parenthood.
Research within ESDM consistently shows significant improvements in language, adaptive functioning, and cognitive development, as well as being effective in both group and individual settings. However, there are some limitations with ESDM as cost effectiveness for the intervention is a bit unclear and the lack of experimental design, which future research aims to address these concerns.
So we also wanted to talk a little bit about implementing AAC within the Early Start Denver model approach and the benefits that can come with using AAC alongside ESDM.
So some examples of integrating AAC into this approach are using the AAC device to make requests, which integrates the device into the child's natural settings, which is one of the primary ways of administering ESDM is in the child's natural setting. So this is included but not limited to turn taking or reinforcements using the device. Also, because ESDM relies on consistency to be effective, AAC will simultaneously be used with the approach, which therefore will improve communication because we know that consistency in using the ESDM approach and using AAC devices is going to give you more positive results. And ESDM is centered around the stages of development, which helps with pacing and choosing developmentally appropriate AAC tools for the child. Thank you so much for watching our video, and we hope now you know a little bit more about the Early Start Denver model.